Russ, can you hear me? This is Lori.
Hi, Lori. How are you?
I'm great. How are you?
I'm good. Thanks.
Are you going to the CFO exchange this year?
I'm not. I've got my fiscal year ends in May, so we're knee deep in budget, and it's not going to let me go. I'm going to go to the next one. So I like that meeting a lot. It's
Yeah. Good
it's
networking, learn a lot.
yeah. It's always not people talking at you. It's you talking with everybody. So I
Yeah,
like that.
agree.
I've always brought something back from that meeting that I've been able to use.
Same.
It's always been good. So
Good afternoon, this is Sarah with the Department of Medicaid. It's not quite 1 o'clock and we're still clearing the waiting room, so we'll give it just a few minutes before we get started.
thank you, Erin.
You're welcome. And as of now, I have yourself and Lori on. I'll keep an eye out for other members as they come on.
Okay, thank you. There's Chris. There's Lane.
Oh, sorry about that, Russ. Good afternoon. It is 1 o'clock. Our waiting room is clear, and I show 4 out of 5 members logged in currently.
Awesome. This is we'll go ahead and get started. This is Russ Ronaldo. I'm the TAC chair, CFO at Owensboro Health. We do have a quorum. Lori, Chris, and Elaine on the line. Got the minutes from the last meeting that were sent a while back. It's been a while since we met. If there are no edits, can I have a motion for approval of the minutes?
This is Elaine. I'll make a motion to approve the minutes.
Okay.
And Lori, I'll second.
Okay, I got a motion and a second. All those in favor? Aye.
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 All right, motion passes. All right, new business, behavioral health. I'm going to need some help on this. Rosamond Dolan from KHA, I know is on the line. I'm going to ask her to help me through this one. I'm not as familiar with this issue that has been been discussed through some of the KHA meetings.
Well, hello, and thank you all for having me. I know I had also reached out to Nina because I know she would be wonderful at really articulating what's going on. So a while back, WellCare issued, way before DMS started issuing notices about reinstituting prior auth in behavioral health. WellCare had identified through a provider notice that they were going to start the process of concurrent review for behavioral health. And so they were going to have a process to request medical records, but it's not a PA, but it's concurrent review. So following that WellCare notice, there was lots of questions. Well, what does this mean? How is this going to affect us? But before those answers were really given, and I'm just going to go ahead and skip down into number 2 there on Russ's agenda. DMS had issued a provider notice and said that the behavioral health prior authorizations were going to be turned back on. Then, then the legislature got involved, and through House Bill 695, identified and passed language that said all the prior authorizations were going to go back to the way they were back in January 2020. So then that left, lots of questions. WellCare seemed to be out front with their concurrent review process, which I'm not sure we've still got clarification on. From Kentucky Hospital's perspective, we have asked DMS to help us just because it seemed like WellCare was out front with this process, that maybe it would be good to have DMS take the lead on this rather than, have WellCare doing something possibly totally different out over here while DMS is still interpreting the guidelines. So we haven't gotten clarification on that. And then the second piece is around this new guidance that was issued. And we just got this, I guess it was Thursday last week. And so the new guidance that DMS has issued, which was issued after this agenda was sent, is a letter with a lot of rescission language. And so DMS is going through and they're noting the rescission of provider notices issued on this date and rescinding the provider notices issued on another date. And through this provider notice, they are trying to, it seems like, reset based on what House Bill 695 said. And so in House Bill 695, we had the opportunity to work with hospitals and DMS on Friday morning. The Kentucky Hospital Association hosted a call with DMS and the hospitals, and it's an MCO group. And we learned that DMS had intended with the rescission notice to go back to 695 and follow what the legislature has indicated. Previous guidance that indicated that behavioral health prior authorizations would be turned on May 1st is not correct. According to House Bill 695, it's going to be after it has to be no later than or no sooner than June 25th based on that bill. And if I've got that wrong, somebody who is more familiar with that may have that noted, but I believe it is June 25th. And so that is to ensure that everybody has time to get caught up on training, perhaps, and to allow the MCOs the opportunity to provide information and the appropriate notices to providers and hospitals about their prior authorization process.
This is Angie Parker with the Department for Medicaid Services, and you pretty much summarized that very, very well. I know it has been a little confusing with the notice that went out in March and then the notice that just went out last week. So I can address 1, 2, 3, and 5, but it sounded like you did a pretty good job of that. As far as the WellCare concurrent review guidance for behavioral health, we did rescind that before the March 14th PA list because we knew that there was something that was going to be moving forward, whether or not it was the March 14th guidance and then the House Bill 695. So that was rescinded.
Okay,
WellCare
so
should not be requiring concurrent review because I believe that was May 1st that was supposed to go into effect.
yes, and we've not seen anything, and we just had our MCO meetings last Friday, and Angie, we didn't. I don't think it came up that they were backing off that.
Is it so? Can y'all hear me? This is Stuart on with WellCare.
Yes,
Hey,
sir.
Stuart.
Yeah. So Angie, DMS did not rescind concurrent review for inpatient psych. They rescinded concurrent review approval for PRTF, psychiatric residential treatment facilities, but not for inpatient psych.
Okay, I did not know that there was that there was 2 notices regarding concurrent review because that would have been rescinded too, unless with that.
No, and we got clarification on an ops call 2 months ago. It was like, yes, the inpatient psych does remain approved by DMS.
2 months ago, was that before the legislature passed
Yes,
six
yes,
95?
yes.
So is it possible, DMS, that we could go back and look at that then?
Yes,
Okay.
because it was my understanding that that was not an okay, Stuart, but we can go back. I'll go back and look at that. But it
Yeah,
was my understanding that it was any concurrent review, but thanks for
yeah,
bringing that up.
yeah, and I've got it in writing. I can send it to you.
Okay. So then are you expecting to do concurrent review May 1st, starting May 1st for behavioral
Yeah,
health?
yes, yes. We have operationalized that to go live 5/1.
And maybe I'm not in touch as much just because keeping up with the 695 and the rescission notices.
I know it's been a little confusing.
It
Wait,
has
that
been.
well care is a different issue than what DMS has submitted and rescinded
Yes,
and resumed.
yes.
So I'll have to, it was my understanding as the concurrent review issue was rescinded, but according to Stuart, that wasn't so we'll have to go back and look at that. The DMS notice, provider notice that needs to be clarified in the impact of House Bill 695 does supersede the dated March 14th letter. That because of 695, then with the provider letter that was sent and received last week is now what is on the books. That is what each MCO does have their ability to reinstitute prior authorization that was in effect 1/1/20, and any other services that is approved by the Department for Medicaid Services. And that does give that is to give providers, as you mentioned, June 25th, that they may start that date prior authorization for behavioral health services.
Thanks, Angie.
So Angie, will someone, through Aaron, let TAC know about the well care for May 1st?
Yes, sir.
Thank
Because
you.
we're coming up real close to that.
Yes, ma'am.
Thank you. And then,
Any other questions on that? I mean, I know it's been, like I said, I know it's been confusing. I'll try to clarify anything I can regarding that, but as of the April 8th, MCOs made PA starting June 25th.
yes, I do have a quick question, and it's just kind of an ask, and we kind of came up with this during our MCO meetings. So on behalf of the hospitals, they acknowledged, the effort to try to communicate what was happening, but they were a little bit confused. And one of the big issues that they hit on is there has been new staff since 2020 that some of which have never had to get PAs for these services. And so they specifically ask for training opportunities from the MCOs now that we have this runway, that there really be an effort to provide training and education for those UM staff so that they know what the expectation is when these are turned on. So that was one ask. And then the other ask was, assuming, I don't know if they're going to pick and choose and not do the full list or if they're going to do the entire list. But whatever they decide to turn on the prior authorizations for, providers, specifically hospitals, requested that their list accompany services, like some way to know so that people aren't going back and trying to look and see what was on the books in 2020.
Oh, no, they have to give you a formal notification at least 30 days prior to June 25th. So you
Yes,
should have that information before, at least 30 days prior to June 25th.
like with the services.
Yes.
Yes. And any kind of training opportunities, office hours for questions, any additional supports like that would be really, really appreciated.
That's the expectation.
Thank you.
Rosalind, anything on number 4? Is
That I can't
Um,
answer.
you caught up in the wait?
Do you want to take that one? Oh, Angie's on mute. So, partial hospitalization, this goes back to a provider notice that DMS issued back in 2023, October of 2023, I think. And there was a prohibition put on telehealth, partial hospitalization services being provided via telehealth to the patient's home. And so through some back and forth, we did receive approval from Commissioner Lee that these services were okay, but no provider notice was ever issued, which would have, given, would have rescinded basically the previous provider notice. And so because of that, a lot of those services were not reestablished. And so based on that, kind of wondering where that is, if partial hospitalization is now just lumped into 695, or, what the expectation is for that particular service.
That I cannot answer. I would, if someone else is on this call that can, from DMS, that I'm not as familiar with that.
I can attempt to let you know what I know. And so that's not my area. That is behavioral health, of course. And so, but that information went, anytime we issue a provider notice or a provider letter that goes out to all providers, and also to the managed care organizations, so that they follow that goes through a process. And that process goes usually up through the secretary's office. So that letter is in one of those areas. The behavioral health personnel that is assigned to that letter would be able to know exactly where that's at in that process. But we never received full approval to be able to issue that letter. So that's kind of where that's at. And now that that Senate bill has reverted everything back to 2020, it would obviously not really have any impact at this time.
Okay. Any questions?
So 695 is just going to fall into whatever 2020 was.
As far as any prior authorization for behavioral health, that's my understanding.
I'll have to look into, we'll see what we can find on this, but I'm not, like I said, I'm not familiar with this letter. So, and I don't know what all it said. And I don't, to be honest with you, I don't know what PHP stands for. So if you could, maybe if you tell me what that is.
We can get together after the call, Angie.
It's
Okay.
partial hospitalization program.
So
So yeah,
program. Okay.
yeah, and I'll be happy to send you whatever I've got to, if you'd like to kind of get the backstory from our perspective on that.
Okay. Justin and I will touch base, and if we need that, we will. Thank you.
Sure.
All right, thank you. Any questions from the TAC on that item? All right, SB 20 backlog. I know we're seeing this backlog of cases, and I guess we're looking for an update. I know we're seeing things in my shop where we've got MCOs that are running up on the 2 years and are asking for refunds, even though we have cases still on appeal. Anybody from DMS, do we have any update on if we think there's going to be any relief on some of the backlog or not?
Russ, this is Erin. I don't see anyone from the MCO contract area on, so I will take that back and try to get you a follow-up. If there's any specific questions you have, if you don't care to shoot them to me in an email, and I'll get those addressed for you.
Okay. And Michelle Wallace is joined, so we've got a full complement.
Hey, Russ.
Yeah.
Just an update as of Friday when we talked with DMS about this, because
Okay.
it does sort of dovetail into the issues that we hear about, just around the behavioral health rescission provider notices. There was a real concern that turning on prior authorization would increase the number of appeals that would be going in, the SB 20, I guess the iPro appeals. And so
Yeah.
there was a question, Aaron, just about how that backlog would be worked, just knowing that once the waiver is removed, there's going to be more denials. And when those denials hit the system, there's going to be more appeals, and how that could kind of flood an already backed up channel. So just that was the nature of the conversation around
Oh.
why that kind of got put in there again.
Okay, perfect. Thank you.
Of
I will get that
course.
added to the follow-up.
Sure.
And
And go
Rosalind,
ahead.
do we know, do we know how many cases are outstanding and how far they go back from a date range?
I do not. I've heard from one particular hospital that said that they've got a case that's like over a year old, that 2 years old, maybe, that has not had any kind of information. It's kind of been stale. Um, so when we
Is
talked
that,
about
is that the iPro or the ALJ?
iPro,
iPro, okay.
yeah. So when we talked with our MCO contracting group, the DMS representative that was there was Jeremy, and he reported that they were trying to put processes in place to expedite this. And so he said that they were trying to get a 30-day turnaround put in place by May 30th. And I'm just sharing what was just talked about on Friday. So I certainly don't want to speak for the contracting group, but that is what was shared in that meeting.
Okay. So Aaron, I think that would be a question that I would have is what's, just the raw inventory that are still in the iPro
Okay.
and what's the oldest case, I guess.
Okay, thank you.
Thank
And
you.
Rosman, this is Greg from UHC. If it helps at all, I can tell you that I've seen requests recently for looking at historical cases and asking for different documentation. So I can see some progress being made with iPro because they're coming back to us to ask for additional documentation. So hopefully that helps to clear out some of that backlog that you're seeing.
Yes, well, that's good. And I don't see anything. So, when I give a report, certainly rely on what the hospitals say, but it's really encouraging to know that you are getting those requests. And, it was a positive update, that DMS gave, and they really anticipated that the backlog was going to start flowing better. The concern was just raised around the behavioral health scenario where the prior authorizations were going to be reinstituted.
I think
Appreciate
I
that,
got
Greg.
all the questions and I'll get those over to Jeremy and back to you guys. I've worked that process, so I know it is very tedious.
Thank you.
Okay. Going down to section C on number 1, emergency department visits. I know we've talked about this before, but it continues to churn. We've got at least 3 MCOs that are down coding emergency department visits with little or no transparency depending on the MCO. I think you've got, as I understand it, you've got at least 1 or 2 that are using Optum ZD Analyzer as a tool to drive changes, and I believe there's one that has potentially a homegrown software, as I understand it. But with it being a black box and not knowing the reason for the denial or the down code, it's hard to appeal. And we've got providers that have you know, into the four figures, 1,000, 1,300 of these happening, and it's a denial. We should get a reason or a letter. It shouldn't come through on a remit with a level being down coded and no way to go about and at least understand the methodology for the down code. The denial, if I get a DRG denial and they say they don't agree with the diagnosis, at least I have a rationale of why they say they don't agree with the diagnosis. We get a letter that says we reviewed it. We don't think this diagnosis is good. This is why. So if I bill level 4 based on what we see clinically and they come back and say it's a level 3, I'm not getting anything that says this is why.
Russ, this is Angie. Have you submitted any formal complaints with our contract branch?
I don't believe so. I'll clarify with Rosman.
Yeah, and if anything's been brought up in the KHA meetings, I know they meet monthly.
Yeah, the KHA meetings, this is why it's coming here. We're kind
Okay.
of turned to a stall. This has been on there for a long time.
Mhm.
And there's no real movement. I think WellCare has provided some transparency, but I don't know that it's adequate to do what we need to do, or the information that we need to have to be able to appeal.
We do know that certain hospitals have sent some examples with the downcoding, and it's continued to be on our list. So that's why we're raising it to this issue or this level.
Okay, thank you for the notification. I mean, we'll have to get with our contract division to see what's the status is on review of this issue.
So are you recommending that, I guess, we start filing complaints with the contract folks?
And is there a formal process with, because we'll be ready to do that as well.
Michelle, this is Erin. I can make sure you guys have the forms. I'll send those out in the follow-up email for you guys, and then
Okay.
I'll make sure you also have the email address to submit that to.
Okay. So I didn't mean to circumvent the answering of your question, Russ. Go ahead.
No, that's okay.
Aaron, you'll send that, the forms and everything to begin filing formal complaints to everyone.
Yes, ma'am.
And is that, I guess, DMS, is that what you're recommending we do?
Yes.
Okay.
And just for the folks' sake on this call who will file those, I know that there's processes before it gets to the MCO oversight branch. They'll ask questions like, have you appealed with your MCO directly first? And they'll ask about that interaction. So just know that the process is still engaged to where you come to MCOs first and then DMS. So I just don't want you to be caught off guard with that when you submit something.
And I appreciate that, Greg, but I guess my answer would be if I don't have the information to be able to appeal, can't appeal it, right? I mean, if I don't know what the reason is, it's kind of fruitless, right?
Sure, that makes sense. And we can certainly talk more offline too around any individual case that needs some questions. I believe that we've submitted some information over that we've gotten about the process, but I want to make sure that you have as much information as possible. We definitely don't want to be untransparent in these denials or downgrades. So I'd love to chat about that too.
Sure. I think Greg, the Optum analyzer, I think, is the issue in not understanding, at least for two of the MCOs, and not understanding the criteria or the drivers behind it, and how things are driven in it. And I understand that it's supposed to spit out the same answer for every case, but I'm also been in forums where you have providers that are using it and they're, they're getting different answers. So, I've got a lot of questions about whether or not there are things you can turn on, turn off, make more strict, less strict within the Optum Analyzer to create different answers between different MCOs. And I haven't really got a clear answer about that either. So again, it's a black box. And if you can change the criteria within the black box, depending on what MCO you are, then that makes it even worse.
Okay. No, I appreciate that insight.
So,
I know that we've talked about this before, but I'm happy to have a conversation around what I know about it and some of those inputs that are there. And to your point, if the black box has different components in it based on the MCO, I think that could be especially confusing. So that makes a lot of sense.
okay. Appreciate the opportunity to have that conversation with you guys.
Thank
All
you.
right.
Well, I did want to say it is correct. You should contact your MCO. And if you aren't able to get anywhere with them, by all means, there is the complaint process. But it sounded like to me that you all had these conversations, but maybe not.
Yep, we have.
Yeah, we have. But appreciate that. Okay. Any other questions on that one? All right. DRG down coding. So this is another issue that has been on the KHA calls and the MCO meetings, and it's a year-old issue. I think this is we've had DRG down coding, so the MCO does a DRG review and changes the coding, right? Denies, says this diagnosis or this is not supported, we would change it to this. We were seeing MCOs, if we did not change the coding in the medical record, which we won't, they were denying the whole case instead of paying on the DRG change that they believed is correct. And as I understand it, we're starting to see down codes where we're not even getting what DRG is provided by the MCO, so we're losing that information. Rosman, anything else on this?
Sorry, I'm having trouble getting off mute. No, I think that's accurate. Denying the entire claim when really it's just a claim line issue. And then also not giving a reason for the downgrade, just saying that they disagree with a primary or secondary diagnosis code.
So this is Meredith. This is from Passport, and we did discuss this in our call, Rosman, and the DRG downgrades. I think it looks like we're combining 2 and 3 together. So, okay, I just want to make sure. So one piece of this where we talked about changing the records post-discharge, that was, I think, an observation piece. So that, I think we're mixing a couple things together there, and that is closed. The downgrades where no DRGs provided, we are submitting something stating what the DRG, we're not changing DRGs, it's the payment that's being changed, and we can talk through that again if we need to, Rosman. We've explained that on, but we are absolutely not changing DRG codes. There is a downgrade to the payment, and that is being sent over in a notification to the providers. And then on the recouping the entire claims, we did send that over on, I think there was a couple of that we removed that to monitor status because there was only a couple that was incorrectly done by an adjudicator accidentally, and that was complete. So that was moved to monitor status, and that was just an error. So that recouping the entire claims instead of single lines was an error that occurred. We got the examples, and that was closed. So I just want to make sure that we're not mixing those things together. So are you still seeing issues with that? Because I know we did discuss that on Friday, and we closed that issue for recouping an entire claim instead of a single line. So that's still a
Meredith,
concern.
we can confirm though that those claims are repaid because of the person's error, right?
That's correct. That's absolutely correct.
Okay, so just to clarify, the claims where the entire claim was recouped rather than a reduced or different payment was provided, those were errors and those are being corrected.
Yes, that's correct.
So can I ask another clarifying question? So if there's not a DRG change, then why is there a payment change?
There's a DRG down coding, but that we're not changing. I think the question was that we were sent, there's a diagnosis change and we're not changing anything to a diagnosis. But the payment has changed and there is a notification sent on the change of the payment. So I want to make sure that you are seeing the change of the payment that is being sent over. There's no change to anything on the claim for the diagnosis, and that is being communicated to the provider. So if you have a question about that or want an appeal, there's definitely documentation that you can send over to us in order to work through that process. There's medical records reviewed, and if the diagnosis doesn't support that DRG, then that's what makes that a down-coded DRG. And that's sent over on the documentation. It states that medical records were reviewed, and that DRG is not supported based on that diagnosis code.
Yep, and I'll just jump in and say that is done by our claims processors individually. It's a manual process where they review the claim, any of the medical records that are submitted with it, the diagnosis codes with the services that are billed. And it's done in-house by Molina staff. And it's not a vendor. It's not automated. There's no AI used or anything else.
Are they identifying what they believe is not supported?
Yes, absolutely. And
yes,
that goes out in a letter with the claim.
Okay. Did they give the rationale why they believe it's not supported?
Yes, they do.
yes.
Sorry, I'm trying not to talk over Meredith. Sorry, Meredith, I'll let you go.
You're fine.
Okay. If they're given, so Rosman and TAC, if they're given the diagnosis is not supported, and the reason why it's not supported, is there another issue that I'm missing, or another concern that I'm missing?
We did talk about this, and that was the response on our call on Friday.
The providers that brought up the concern, do they concur with that?
I think it's in a monitoring status right now. I mean, obviously, I think they're looking at these to make sure that they are consistent, that they do get the information that they need. But that was the consensus from the representatives that we had on the meeting on Friday.
Okay.
And we don't.
Maris, I see UK on the list and I'm checking on it, but I haven't heard of this issue with Passport. I heard of it with another MCO, that we weren't being paid, period, not just a difference between one DRG versus the other, but I don't know about Passport, so I can't commit to that. I'm checking on it as we speak.
Okay. Well, let us know if we need to discuss it again or go through it, Elaine, please.
Okay, thank you.
Anybody else have any questions on these items? Meredith, thank you for the input. Appreciate it.
Yep, no problem. Thank you.
Any other items or discussion with TAC members? Okay, we don't have any recommendations. I'll represent at the next MAC meeting. Our next meeting is scheduled for June 24th of 2025. And if we don't have anything else, I appreciate everybody's time. We'll be adjourned.
Thank you.
Thank you.